Okay, we're going to call this Health Committee meeting to order at 1:01. Shelley, will you, well, wait a minute. Curtis, would you do the invocation? Everybody stand, please.
Dear Heavenly Father, Lord, thank you for this day. Thank you for this council meeting, Lord. Be with our chairperson as she leads us through this committee meeting. Lord, bless all the council people here today. Bless our visitors. And just be with us as we go through the day. And we ask for your guidance and direction. In Jesus' name we pray. Amen.
Amen. Shelley? Oh, yours.
For the new council members, I'll need you to not only tell me you're here, but yes, you want to be a member of this committee.
Okay.
Frankie Hargis,
Present.
Brian Warner,
Ahade? Yes.
Bill Anglin,
Here.
Bill, do you want to be a member of the Health Committee?
Oh, yes, yes. I knew you say it, but I couldn't hear you.
Keith Austin,
Here? Yes.
Jack Baker,
Here.
Harley Buzzard, Joe Byrd,
Honey?
Sean Crittenden,
Ahane? Yes.
Don Garvin, Wanda Hatfield,
Yes.
Rex Jordan,
Here? Yes.
Dick Lay,
Here.
Curtis Snell,
Here.
Janice Taylor, here, David, Victoria Vespez, David Walkenstead. We do have a forum.
Thank you, Shelley. Okay,
Can
need
I
a,
ask a quick question?
yes.
Regarding those who were just reelected, do they also need to answer yes?
Um,
Probably so.
Probably for good measure, wouldn't hurt. Dick, do you want to continue being a member?
Yes, ma'am, thank you.
And the other one would be Stick.
All right, we're going to blackball him. Just kidding. Okay, I need approval of the minutes.
Make a motion, they be approved.
Second.
All in favor?
Aye.
Okay, and we'll move on to reports and for Claremore Service.
Good afternoon.
Good afternoon.
I think you have my report there in front of you. Collections are doing well this year. Pretty steady on outpatient visits. A couple of the big things I'd like to, one follow-up from last month was the MRI. The building, we'd had some issues with the building that it was in. It's a prefabricated building, modular building out back. The vendors are still working with area office on trying to get that fixed and figure out what to pinpoint the problem. But in the meantime, I brought it up here last month that we were working on a contract with a vendor in Tulsa to continue getting those MRI patients seen and taken care of. And that's that on the front side. On the clinic side, the patient side, nothing's changed. Everybody does things just like they always have on our end. We take care of the change and we work with the vendor in Tulsa. That's the only change, is that instead of coming to the hospital, they drive over to 71st and Lewis to have their MRI done. But, and I understand they're already booked out. We've gone back and picked up those that were scheduled and then canceled. And now we're booking out forward again. I understand we're booked out about 4 weeks. So that will continue while we're trying to get the modular building repaired and the one there at Claremore back up and running. Secondly, we have an orthopedic program that we're using out of Oklahoma City through the Purchase Referred Care. It's an all-inclusive package down there with the Dr. Wheeler. So all of our referrals are going to Oklahoma City outside of full joint replacements and spines, I believe. We're referring them down to Oklahoma City. the issue of transportation had come up where we've got a meeting set up with the Miami area. One of the tribes said that they wanted to meet with us and maybe they could designate a CHR 1 day a week or something like that that would drive these patients down to Oklahoma City, those that didn't have transportation, and we could maybe get them all scheduled on 1 day. So that's what we're doing up in that area. But we'd had some questions about the orthopedic referrals. Any questions?
Counselor Buzzard?
George, how long, what was the problem with the modular building? Was it molten or leaking?
Somehow or another, what I've been told is that moisture got down into the flooring of it, caused the flooring to swell, and then the shielding all came loose. That lead shielding in there, which just the images that it was taking.
So was that under, I guess, it's under warranty?
Yeah,
Contract,
well, it is, and that's why they're all pointing the fingers at each other and working on trying to figure out who's going to pay for what. But the thing I wanted to get done was to get something going on the side here so that our patients still get taken care of.
And how long do you think it's going to take to get done?
Oh, I'm hoping the talk at the table is within the next 2 or 3 months by the end of the calendar year. So we're hoping.
The other thing is on the ortho contract, why did we go to Oklahoma City? You couldn't find anybody in Tulsa to do that?
That was a contract initiated by the area office in
I see.
Oklahoma City.
Yeah, that kind of-
And that was, they called us and told us to send everybody we had, all the orthopedic patients down there.
Well, I'm glad that we're getting transportation because I knew that would be a,
Yes, sir.
appreciate that.
You bet.
Thank you, Madam Chair.
Counselor Lake?
Thank you, Madam Chair. And to follow up on Harlan's question, the transportation to some of our clinics to Oklahoma City, we're probably going to bump into some of our folks who are elders
Mhm.
and maybe can drive from city traffic, or they're not driving at all anymore. I wonder, you don't have transportation, that's what I'm hearing. I wonder if, Connie, if you could get with George and see if we could work out some CHRs. I know we've got some folks that are going from Copan pretty quick unless we can find something for them in Tulsa. And Oklahoma City's a long way for some of us. Thank you.
Any other questions? Thank you.
Thank you.
Ms. Connie, you're up.
Good afternoon. I visited with Madam Chair, the new Chair of the Health Committee, to talk about the format and the content of what you guys would be interested in hearing during this time. I didn't want to be presumptuous and present the same information, and there will be some things changing because our reporting will be changing because of our new electronic health record. But she thought the purposes of the first Health Committee for you guys, it might be good that you meet firsthand the key staff, the key leadership in health, so you can put a name with the face and know who you're talking to, perhaps. And so they will be given a short report on each of their departments, which is what I usually do. So with that, I'd like to start with Dr. Chuck Grimm. He's the Deputy Executive Director of Health.
Good afternoon, everyone. With you, and welcome the new counselors. And if there's anything that we can do to assist you, please let us know. My name is Charles Grimm. I'm the Deputy Director for the Health Program for Cherokee Nation. I spent 26 years with Indian Health Service, and I've spent 6 years with Cherokee Nation now, going on my 7th, and I've been enjoying it all. The programs that I oversee directly, of course, when Connie's away from the office or out traveling, things come through me, and I have the authority to pretty much sign and keep the office moving all the paperwork that needs to be done financially and HR and things like that. And then as far as direct supervision, I have somebody who's not here, I don't believe. Rhonda Cochran. She supervises the clinic administrators. So the 8 outpatient clinics fall under my domain directly. Also oversee finance, and the director of finance and one of his staff people are here to say a little bit about that. Facilities is kind of a jointly operated program. It is really under Bruce Davis's office, but George Long and Health Facilities Programs answer to me in a dotted line fashion. So I oversee those programs as well. And then public health, the public health programs of the tribe, and Lisa Pivick oversees those. So they are all here today, and instead of take longer, and the ongoing council have seen me a lot of times, and so you know how to reach me. I will leave some business cards here at the end, also so that the new council members can take some, and anytime you need anything and you can't get a hold of her, feel free to call me and I'll see what we can do to get things taken care of.
Thank you very much. George, do you happen to be within eyeshot? Okay. This is George Long. He's the Senior Director of Health. You happen to be within eyeshot. Okay. This is George Long. He's the Senior Director of Health Facilities.
Good afternoon, everyone.
He's broke.
The health division for 18 of those years. I oversee the everything in every facility. The health centers have their own custodial staff and so forth. What we do pretty much is provide 2 levels of maintenance work for all the health activities that we have. One level is preventive maintenance, where we try to keep machinery operating using manufacturers' recommendations on maintenance service and so forth. And the second is call-in work orders. That's when something is actually broken or malfunction, and we send crews out to do that. We deal about 100 of each of those types every month, and some of those jobs may take an hour, and some of those jobs may take 2 weeks. Sometimes we run into repairs that we're not equipped to handle, so we do contract for that. And we've got contracts and blanket purchase orders out so we can get repairs started very quickly. We use a set of software to both track, to record and track all these work orders so that nothing gets forgotten in the system. So that's reviewed every month. And we have a person that answers the phone for the call-in work orders, and we have all the clinics know the number to call, so they'll call that number. And this person has been there for 8 years and knows pretty much how to make assignments. People trades in those trades, plumbing, electrical, HVAC, and so forth. We also have a property staff, a very small property staff, and they perform the transfer of furniture and equipment whenever there's a move, when someone moves from one location to another, and that happens more than you would think. We have a very large move coming up this week with behavioral health, moving from a 14,000 square foot building into a building that Health Services recently purchased and that we've recently remodeled. So they'll be doing that. They also supply forms. Health Services has standardized their forms, and we keep the supply of those forms there in the property office, and we supply all the clinics and all the activities with these standard forms, and we order them and keep them in stock so we always have a supply readily available. Property also handles the confidential paper that accumulates that can't be thrown away, that has to be disposed of properly. We have lock containers, many lock containers in all our facilities, and property staff picks those up, and right now we're bringing those to a recycle facility here at the complex that the resource group operates, and they are retained in locked containers until such time as they're shredded and destroyed. Custodial services, we provide custodial services now for the
Training and Education Center, the old Homeland Building downtown, which now occupies our Health Information System Center, and also the Privacy and Compliance Group. And now, as we move people into our two new buildings, the Cascade Building and the Clinic in the Woods Building, we'll be providing custodial services at those facilities. The division has a bunch of vehicles, and we track and produce the required monthly reports on about 150 vehicles that Health Services operates. Probably use some of those in your CHR things that we talked about just moments ago. To do all this, we've got a staff of 22 people, and we're located at 1853 West Choctaw in Tahlequah, right next to the new police station down by the airport. We expect to add about 3 or 4 staff to that very shortly, custodial people for our new facilities. We dispatch most of our workers from that facility, although we do have staff that are stationed at Jay, Salisaw, Muskogee, and Veneta. So we don't have to travel quite so far. We do spend a lot of windshield time, though, and it takes us a while to get to some of these locations. My office phone number is 918-458-7662. 458-7662. My cell number is 918-316-1351. Any questions?
I'd like to add that George played a big role in the successful application of the joint venture for the medical campus here in Tahlequah, and he's one of those that does a lot of work and doesn't get a lot of recognition for the big things, and so he gets a lot of credit for that, or blame.
Well, I hope it's great.
It's credit. Thank you, George.
Thank you.
Elizabeth Odell. Some of you know her from the Attorney General's office, and they felt the need for health to have their designated own general counsel, and she has played a tremendous role in streamlining a lot of processes, and mainly that in contracts, I'd have to say, allowing us to get those things processed a lot quicker. So,
I'm Elizabeth Odell, Health General Counsel. I am over privacy and compliance, health contracts, and then basically just anything health related from a legal standpoint, other than litigation. I don't handle the litigation, the AG's office still does that. But with privacy and compliance, that has to do with HIPAA issues that may come up or anything like that. We have a compliance committee, and I'm the chair of that. We meet once a month to deal with issues that come up. From health contracts, we coordinate with the Cherokee Nation Acquisition Management Department, but I have staff under me that are that process the health contracts, and every contract on behalf of health goes through that department. We have to make sure employment-wise and for service agreements, so. That's it.
Dr. Nolan?
Hi, my name is Doug Nolan. I'm the medical director at Cherokee Nation Hastings Hospital. I'm a family practice physician. I work along with, or I am part of administration, but I work with the chief executive officer, Brian Hale, who'll be here in a few minutes, also with Ms. Davis, and the medical director, Roger Montgomery. Basically, my job is to oversee the quality of care from the physicians there at Hastings Hospital. I work with the patient advocate, so if patients are having difficulties, I work with her to make sure that they get the care that we feel that they deserve. I also work with the clinics, so that if your medical directors in the clinics are having difficulty getting patients in and out of the clinics, or from the clinic to the hospital, I work with them to make sure that the patients are seen and taken care of. I've worked with a lot of the council members before. Maybe they have questions or concerns, and they go through Ms. Davis, and I review the chart and try and get the information back to you about the quality of care they received. And again, sometimes the patients just don't necessarily know how to access the system, or they have concerns. So it's not uncommon that I call and visit with them and tell them how to take advantage of the services we offer.
One of the many things I love about Dr. Nolan is he not only oversees 24-hour care of the hospital and all the patients that are there, but he has his own clinic, he has his own panel of patients, and it's not uncommon to see him working in the emergency room or the urgent care. So he is a true team player.
Thank you.
Brian? Brian Hill is the Chief Executive Officer of the hospital.
I made a little handout for you all that just has some terms that might be useful for you to know. I'm passing those around, as well as a list of our most recent accreditations and achievements in a few of the services that we offer there at the hospital. So my name is Brian Hale. I'm the Chief Executive Officer for the hospital. I also oversee the EMS operations for Cherokee Nation EMS. Hastings is accredited via DNV. That's the deeming authority for CMS. That's how we stay accredited. We have about 60 beds in the hospital. Some of those we have given up for sleep studies to be done there. And then the majority of our work, though, about 80% of the business that's done there at the hospital is on the outpatient side of things. That's the emergency department, urgent care, as well as all of our ambulatory clinics. And then within those, that ambulatory setting, we also have physical therapy, we have optometry, we have audiology, a lot of specialties that you don't typically see in an ambulatory setting or a hospital, especially in a rural setting. But we do offer a lot of specialty services. We focus a lot on improving the infrastructure and improving the patient experience. The hospital is fairly old. The age of plant nationwide, the average is about 9 years. Hastings is a little over 30 years old as far as the core of it goes. It was designed to see about 60,000 patient visits a year. We do upwards of 400,000 visits a year. That is with some annexes that have been added on, but we really strive to improve our workflows, do as much as we can to improve the patient experience and to improve customer service. You'll hear people say, well, you can't complain, it's free. Well, we do not tolerate that attitude. That is not our expectation. And if you hear any of our staff saying that, we really like to discuss with them that we have an expectation that we provide excellent customer service to every patient that comes in. We've done a lot of service, customer service training, and we continue to do that as well. So I don't want you to have any misconceptions about what our expectations are at the hospital. The other thing that we do is work on infrastructure. A lot of the infrastructure in the hospital needs to be replaced, and we annually conduct a hazard vulnerability analysis, looking at what our most vulnerable positions are as far as the physical infrastructure, and we try to upgrade those as we go and as the budget allows. And there's quite a bit of that to be done. But what we're really excited about is the ability to do the joint venture with IHS and build a ambulatory facility to take a lot of that outpatient care burden off of the main hospital. But I'm available anytime. We've handed that out. I also have some business cards for all of you, but we really do strive to be available for you anytime you need us. So I'm happy to answer any questions you have today. If not, you'll have questions coming up soon for us. So anyway, thank you all very much.
Thank you, Brian. Dr. Jones is the Senior Director of Dental Services.
As she said, I'm Senior Director of Dental Services. I've been here about 3 years. I was in private practice for 20. We've tried to change the way we do business in the dental department, and we've changed it from a public health setting to a private practice model in a public health setting. So we focused on customer service. We're focused on increased productivity, increased efficiency, and increasing our third-party revenue. So over the course of my 3 years here, we've increased all those things tremendously. We've opened up access about 38%. So my job is to facilitate each one, support all the clinics, make sure they have what they need in order to meet our goals, to work with you guys if you have constituents that have issues that need a little bit of help getting into our system, explanations, dealing with them one-on-one, working with the patient advocates to make sure the patients are satisfied. So I'll leave some cards also, and feel free to contact me at any time, and we'll try our best to help you make sure your constituents' needs are met. Okay.
Lisa Pivick is our Senior Director of Public Health.
Good afternoon. Thank you for having us today. I am Lisa Pivick. I have been fortunate enough to be here for the last 24 years. I am a Cherokee citizen and native of Peavine. Go Peavine. I oversee all the public health programs, including Women, Infants, and Children, WIC program, the cancer programs, which include the early detection programs, and all the community health promotion programs, plus the Male Seminary Recreation Center. You have our report for Cherokee Nation Health Promotion in here, so I won't go over any of it. A couple of things that I will highlight, or one thing that I will mention, is that we have 11 working days before we become, hopefully, the first tribe to become accredited in public health in the nation. And so our staff is working hard on all the domains and standards and getting ready for our site visit, which it will be historic, and hopefully we will, I have no doubt we will pass, and it'll be another thing for us to work on as the years go by. Most of our programs work on core issues of public health, and we work on the preventable causes of disease. We work on nutrition, physical activity, and tobacco abuse. So I also have Dr. David Gann with me, and he heads up our newly organized surveillance department, surveillance and monitoring. So, anybody have any questions? Yes.
From the report on the public health educators, I did not see the Rogers County public health educator listed in here. Was that an oversight, or do we no longer have one? Or
We no longer have one in Rogers County.
Okay, are we going to replace that position, or are we just not?
To my knowledge, that at this point won't be replaced.
Okay. And then I was trying to look up some things on diabetes prevention program and the nutrition program, and the public health website says it's being updated. It should be fully operational July the 15th. It is not. Is there a date that that's going to be to go, or?
Have you checked in the I actually
Last
looked at
night.
it this weekend.
Last night I went to the website, and you can get to the homepage, and then when you try and click on the individual programs, it says we're updating this. It should be up July the 15th.
Okay, I'll have to double check on that, because I was actually on it this weekend looking at the article on Baby Friendly Hospital, and I was clicking on some of the links to see if they were working, and I was using my mobile device, so I can
Okay,
double
well, I
check
was on a
on
laptop, and specifically it was the diabetes and the nutrition.
And it may be that we haven't, the diabetes prevention program is what lies within another program. We may still be getting information from
Very good.
them and updating that.
All right,
Yeah.
thank you, Lisa. That's all I have.
Any other
I have a
questions?
comment.
Yes.
Lisa, you do a good job there at the facility. One thing I would recommend is do some type of a survey for the members. We've made some good improvements there, and you have a great staff. And see what it is that our members would want to add there. We're not going to make any promises, but it'd be good to see what it is that they'd like to have there. We've done the walking trail, we've, machines, we've done all of that. So let's do a little survey to what is it you guys think this facility needs.
That's a
We
great.
have 9,400 members.
Yeah,
I mean,
94,
that's-
and look at the number of visits in 1 month.
Yes.
It's quite a
Well, I
few.
always compare the number of visits we have there compared to the number of visits that goes to the clinics.
Right.
Because the more we push through there, the less we go through the
Absolutely.
clinics.
And you're absolutely right. As a matter of fact, in working on the public health accreditation standards, one of the issues that we highlighted is the lack of a customer service survey at that particular facility. And when I just recently sat down with Julie, the director,
Yes.
for our annual evaluations, we discussed that and trying to
Okay.
look at a method of doing a customer satisfaction survey among the members.
Good. Keep up the good work. Thank you, Madam Chair.
Thank you, Lisa.
Rick Kelly is the Senior Director of Health Finance. Amy Sands is his right hand. They're also two-headed monsters. They keep us in line and help us find ways to say yes.
Good afternoon and welcome to council members. My name is Rick Kelly. I've worked for the nation for 23 years. I thought it was a long time until I heard George. But the year I came, it was 92. That was the first year that self-governance was open to the Indian Health Service. And so we actually managed that planning grant. There were 17 tribes involved nationally. And so in 93, we were the first tribe, but there were 7 tribes that graduated, if you will, and signed compacts and funding agreements with Indian Health Service. And I think back then our budget was probably less than $10 million for health. And the budget you'll be voting on this evening is $335 million for our health system. Big change, a lot of progress, and one of the things that we wanted to be sure and do with the FY16 budget was to account for we've had 4 expansions, health centers. We opened 2 this summer, Oshaleta and Salisaw, and we expect to open Stillwell and Jay first quarter of 16. And so I remember in the final markup, I think Connie and wanted to make sure that we covered the needs related to those expansions. And so I think there's 100 new staff in the 16 budget. It's our largest budget we've ever submitted since I've been here, and I've been here a while. But it's a good budget. I think it'll address the access needs for 16, and moving forward we have the joint venture to look forward to, and we're real excited about that because that's going to provide that access at Hastings that's needed. And we have just a little bit about our health finance office. There's 9 staff. Of course, they are heavily involved in the budgeting and control of the budget, and cash receipts, and then managing those payables that we've centralized. And I think the other side is our business office. There's probably 40 staff, and that's where we do the third-party billing and collections for system-wide. And I think in the 16 budget, we've estimated about $120 million we expect to collect. That's the largest amount we've ever budgeted. And so we've actually had growth in our third-party efforts each and every year, double-digit, probably averages 9 to 12% growth in third-party, and we have to maintain that growth. And in fact, we're in the middle of transitioning to a new EHR, new health information system, having some growing pains, but we expect once we get it fully implemented, we'll really be able to take advantage of what it brings to us in terms of more accurate billing, less denials. And so we expect our third party to grow at an even better rate. Can't think of anything else to talk about right now. I guess I'd be glad to entertain any questions or you might have about our finances. We feel really good about our budget for 16s.
Any questions?
Or
Thank
for
you.
Amy. And by the way, we work real closely with Jody Reese, and he's great to work with. So a lot of times if you have questions, he knows how to get hold of us. Glad to answer.
Stephanie Wycliffe is the health HR liaison, and she helps us expedite and direct issues with HR to the right people. And
well, my name is Stephanie Wycliffe, and as Kai said, I'm really the liaison for this organization because health represents 2,000 employees of the Cherokee Nation, the tribal government. So it keeps us quite busy, and we meet monthly. I mean, we meet weekly with HR to help spur some of the initiatives that we have in regards to staffing, compensation, anything kind of HR related. And so I'm really a support service for all of these folks here, and I know I've been in contact with some of you guys before when you've brought up issues, and we've taken a look at Ms. Davis's direction. I'm looking forward to what's coming down the pipe with the expansion, and have a lot of work to do with the new staffing as we expand. So good luck to all of you.
and Jeff. I'll save Jeff for last because I'm quite sure there'll be questions. Jeff is the Senior Director of Pharmacy.
Good afternoon. For those of you that don't know me, my name is Jeff Sanders. Little background on myself. I've been with Cherokee Nation about 18 years. I am a tribal citizen. My great-grandfather served in the Dawes Commission. His name was Dog Sanders. My dad was Dog Sanders. And I passed that name down to my son, even against my dad's best wishes. So, anyway, the pharmacy program that we have, we fill about 2.2 million prescriptions, and that's a lot. It's a huge portion of the health care within our health system. I think many of you probably realize that too. You know, a lot of concerns and things are often developed around the pharmacy program because of what we have in volume and size of our service. But along with pharmacy, we also do specialty services. For those of you that may not be familiar with them, we have warfarin clinics, which we call it an ACC clinic. We also have lipid management clinics where we work in conjunction with the providers in both of these. And recently, we just started a hepatitis C clinic in conjunction with Dr. Amira. And the latter is of significant importance to me, and I think it'll become significant importance to you as well. Hepatitis C is now curable. It's no longer just a treatment of disease symptoms, it's actually curable. And we're going to focus a lot of time and attention on this, and it's an expensive treatment, but in the long run, it saves lives and families and saves Cherokee Nation a lot of money too. There'll be more to come along, but I wanted to kind of prime you guys for that too, because it's kind of a passion of mine as well. Those patients have kind of been on the outlying of treatment for years and years, and now that we've got a cure, it's just really going to be nice to see these patients actually taken care of appropriately. If you have questions, I'm more than happy to field them. I think that's why Connie probably saved me for last. I will say with the transition to the new electronic health record, there's been some challenges with pharmacy which quickly developed. And a lot of it is centered around the new software and our ability to process prescriptions. A lot of people are working on it. We're making lots of changes. And I will say, those of you that get an opportunity to speak to the staff, please thank them, because every site, our staff have worked typically now 12 to 14-hour days, and it's still ongoing. And they're tired, but they're still plugging away trying to take care of patients. Those challenges that we have before us, once again, I mentioned we have people working on them. We've got a meeting tomorrow that's actually with the top 2 folks in Cerner Retail Pharmacy Solutions and a programmer. And I think that's where we can make some effective changes in the programming. The new system, just to put it in perspective, in our old system in RPMS, when we typed in prescriptions, it was all done right before us on a keyboard. Well, now it involves a mouse, so we have lots of clicks. And there's lots of things within the new system we think we can remove to help improve our flow, which overall we hope will help improve our service as well. So that's just kind of an FYI up front, quick analogy of what we've got going on. So I'm more than happy to entertain questions.
Yes. Your father was on a board that, back one of my first jobs I had with Agnes Cowan. He was a fine man.
Thank you very much. I get that from a lot of people.
Yes.
Hopefully I can follow in his steps as well. He was also a very intelligent man. He was a pillar of our family.
Yes.
And my dad had several doctorate degrees. So,
now, that was the good news. Now let me give you the bad news.
Okay. There's always a primer.
What kind of time frame are we looking at to start getting some relief from the services with this new system?
If I had an honest answer, I'd give it to you.
Give me a ballpark.
We're meeting right after this meeting.
Yeah, we've got a
See what we
meeting.
as administration need to do to support them and get things caught up a little better. So.
Everything else, you've got a great staff. You've been with them now 4 years, from looking around here. And we've come a long ways, and we've hit a little glitch here, and I know council members were all getting phone calls, and I was just what kind of answer could I give the constituents?
Councilor Byrd, honestly, once again, if I'm just going to guess,
sure,
I'm going to guess and say speculatively and hopefully it's within the next 90 days.
Okay.
I'd like to see it next week, and I know patients would and staff would as well. But that's the only thing I can tell you at this point. It's going to require some programming changes that we think will help us out. Okay. And once again, Connie and I, we're going to have some discussions today. And from my perspective, whenever we started this, I thought a week to 10 days we'll be engaged, we'll have the bugs worked out. Well, it's just not been quite that fast. It's part of it too is the entire health system of providers and nursing staff and all of the staff learning the new system, which helps it work more efficiently. A part of it up front was providers putting orders in. They had to select from a list of pharmacies to come through electronically through SureScripts, and a lot of them were selecting the inappropriate pharmacy. And that creates a big problem for us and them as well. And now that's decreased as physicians get used to the system. So things like that over time are going to help us as well.
Okay.
Our experience is the first time the patient visit is the longest.
It is.
Because you have to, there's more data entry involved, and after that first visit, the next visit should go much more smoothly.
Well, thank you for that
Sure.
answer. That. Thank you, Madam Chair.
Counselor Lay?
Thank you, Madam Chair. And we're all getting these phone calls, and it's a lot of it's, not all of it, but a lot of it's about the pharmacy. I can't get my scripts, and they say call back next week, and they're running out. What to do in a case like that? Is there an emergency program you got pull out of your back pocket?
To be honest, we're telling patients as well that if you'll bring your old bottles with you, it'll be a whole lot faster. I can slip you a few in your bottle. Just a little TV, but you know, honestly, that's the true solution right now. Then it's not a lot. It's not a lot what I would have done differently, even in a retail environment when someone's out and we couldn't get an authorization from a physician. You know, I'll give you a couple tablets to help them out. We're seeing less of that because patients and us are making the adjustments to the processing flow, and we're seeing a lot better transition of I'm out now to they come in and they're able to get their meds. It's not same day, but most places are about 2 days behind in processing. That's what we're telling them. We need about 2 business days to get our prescriptions done. Some are a little further behind, but for the majority, we're seeing some improvements in that area.
No one should be turned away.
Right.
If
No
they're
one
out
will
of
be turned
meds.
away.
So if you encounter that, they need to let them know
Well,
that day.
some of these
or at that
elders
site.
are calling in like they've been doing for years.
Yes.
And they're not making connection with the, you know, it's not working.
And with that too, Counselor Lay, I want to say also, we purchased a new phone system that integrates with Cerner as well, called AIS. That one is not currently up and running. We're hoping Wednesday we'll have it done where we can turn it on. And we've been into Cerner long enough now to where the new system of prescription numbers is not recognized by the old phone-in system either. So they have to actually physically call and talk to staff now whenever that happens. If they've still got old numbers, they're going to have to phone them in and physically talk to a person.
And so somebody's gonna have to answer the phone to get that done, Ms. Davis.
Yes, we know.
And how, are the Cerner folks still on campus with you guys, or did they go home?
No, there are a few on site intermittently. I couldn't tell you today exactly how many.
That concerns me. I mean, this is, you guys do half, you take half of our budget. And we know that. And so when you were plotting this course, and I think it was the right one for the long run, and I urged you to do it. I'm glad I did, but when we were plotting this course, I feel like we should have had the programmer on site here in Tahlequah for a certain period of time, as well as staff and backup that they all use. Was that done, or
Yes,
did
it
we
was.
send them home?
No, they were here the first 2 weeks for sure, and at each clinic
Did
site.
you run a parallel program for a while, or you just did a cutoff date and that was it?
That's exactly what we did.
Pharmacy was a little unique in that retrospect too. The testing that we did was not actually testing, filling prescriptions, but it was validation testing to make sure that the data, which was very important to us, that was transferred from the old system to the new system was patent. As far as actually testing the process, it was very difficult at best because a test box couldn't truly be built. That's exactly like what we needed to work with. We could do bits and pieces, but we couldn't throw it all together until they flipped the switch.
We're pretty confident. It's, you know, something else this has highlighted is the need to change our processes. And so I think that's what we can talk about in our meeting following this is, you know, not doing things the way we've always done it. And it's a hard transition for the staff and for the patients. But we want to be more customer service oriented, and we know that we're failing that right now in the pharmacy area, but we'll have a corrective measure in about 2
So
hours.
what do I tell my elders when they call me? They can get a hold of me, they can't get a hold of the clinics. What do I say?
I would appreciate a text or a call so I can make a call and let them know.
Okay.
And I do get those calls, and it's just the sheer amount, it's the sheer volume of calls right now.
It is. It's that transitional period we're in right now between the phone systems, and it's gonna be a little bit tougher until we actually get it switched over. And then the new system is a lot easier to use than the old system was.
Counselor Buzzard?
Yes, and a lot of my questions have been answered, but we paid a lot of money for this, $1 million for this system. You're telling us, yes, it's gonna be another 90 days. I don't know if we can survive this another 90 days. I think what's gonna happen, if you work those pharmacies 10, 12 hours a day, they're gonna be looking for a job. That's what I'm afraid is gonna happen. So is there anything you can do to relieve those guys? Maybe hire some people to come in and help with the people?
You know, temp help is okay to a degree.
Yeah.
But temp helps can only do so much, that's our problem. We've got some temps, like up at Hastings, that actually help us out. It's a training issue with data entry, and that's where the slowdown is, which, you know, that's where I hope we can get it corrected quickly.
And I know any new system you put in, you know, you're gonna have these bits, but we've been on this since August the 10th, and I've been pretty patient because I've implemented new systems before, and they just don't work like you think they're gonna work when they come in, but you know, for us giving that much money for this system, I would expect a little bit more out of it. I know you're on a learning curve right now, but I think a lot of my questions have been answered, but
What I could do for the council, if you'd like, after our meeting this afternoon, is send you out what our corrective action plan
Okay,
is.
that'd be
So at least
helpful.
you can be a liaison to the community.
Yeah.
We're working on it. And I think the big important thing is the top dogs of Cerner and this programming issue will be here on site tomorrow, and this message will be sent very strongly to them.
and you know, I certainly want to support you guys, because I know you're doing your best to get
Appreciate
this
it.
thing remedied, but you know, we get these calls, and we're not here to beat you over the head with them, but you need to know what we're hearing too.
Sure.
The other thing that I'm hearing too, Connie, and you can maybe explain this to me, is in the Cerner system, if a person went there for an earache or scabies or ear infection, the provider has to sign off through Cerner, or as the nurses before could actually see those patients. And to me, I'm hearing that's holding up the system too.
I'd have to know specifically about a specific
Okay.
incident, but what it may be is, again, there are some practices that have been
Yeah, and
in
that-
place that we
And that's what
we
I'm
need
hearing.
to
The nurses
improve.
could actually see somebody with sore throat or an earache. In order to get any medicine, it has to go to the provider to sign
No
off.
medication can be prescribed without a physician or a provider's authorization.
There. But I understand what you have to do is go into the Cerner system to sign off on it.
And that was the same as before.
There.
Yes.
The other thing that I'm hearing is, and I'm sure you know it, but we're doing 1-hour appointments for patients now. Is that
We,
right?
at the beginning, we did ask to scale back to 1 patient an hour to allow the providers time to get acclimated to the system. Just to share a few statistics with you, before the Cerner implementation, we averaged seeing just over 14 patients a day
Yeah.
system-wide. And by early last week, we were seeing just over 11 patients.
Yeah.
We look at this data every day, so.
But I'm sure that you're on top of this stuff, but
But I
that's
was
just what
pretty
we're hearing.
pleased with that rapid turnaround. Now, our goal is, of course, there are 20 slots for appointments and drop-ins, and each clinic has their idea of the best way to do that. So we're meeting with each of those medical directors and clinic directors. We want to make it as standardized across the system as we can, but we also recognize there's unique needs in each community and try to be sensitive to that.
And the other thing that I'm hearing, and you may have already heard this too, that we're having patients that come out of Hastings Hospital and go into some of their clinics, because the clinics are only about a day behind in the roof is. Whereas Hastings is somewhere 2 days behind, 3 days behind. And I can see that, you know, if they all have the same chart number, that they can go to Ocean up there and go to their pharmacy. So I don't know if you heard that or not.
I
I've
think
heard
I
that.
saw an email over the weekend that said someone loved
I don't know,
Hastings, went
if
to
you- I
Benita.
don't see anything you can do with it, I mean, that's just the way the system works, but, you know, it's putting a strain on our pharmacists at our rural clinics too, so.
Well,
So we're
something
feeling
that's
fine.
unique in Talafol versus the outlying clinics is the outlying clinics, patients have become accustomed to calling in their meds and
Yes.
having them mailed, which is great. In this area, they're used to walking in, and I'm one of the guilty ones. I'm out of my meds and I need them today, Jeff. I don't wanna wait over
That's
20
been a big
minutes.
change, yeah.
And so that's a big change for the people that are seen at Hastings, and I think at Three Rivers as well. So I think it's just changing the culture and the expectation and letting our patients understand this is easier. I wish, I will have mine mailed because it
Yeah,
makes
I'm
more
sure.
sense.
Well, Jeff, I know you guys are doing the best you can to get it resolved, but 90 days is we're really gonna hear a lot of this. If we have to put off people that long. We hope so. Hopefully we can get it resolved any quicker than that. I appreciate the job you guys are doing. I know you're doing a good job. So, I just think you need to hear what we're hearing on the outside. So, I'm not saying just to, just to be saying it. It's something that you guys take into consideration.
Sure, it's well understood.
If you can help us.
We feel the same. It's not the patient's fault in it all.
Yes.
And unfortunately, I think the pharmacy staff kind of feels caught in the middle.
Well, that's what I'm here, yeah, I'm here at the 10 and 12 hour work days up there too.
And they are, but
I'm just a little bit
they're doing
concerned.
that to try to take care of patients.
And that's what they tell me, we're there to take care of patients, and they have, so I appreciate that. Thank you, Madam Chair.
Counselor Vasquez?
Yes. Hello. I have, thank you, Madam Chair. I couldn't figure out who to ask this of previously, and it may seem like a very small thing to you guys, but when I used the Bonita Pharmacy, and I wondered why. I'd asked them a couple of times, could you take these bottles back and recycle them? And they said, no, we don't do that. I have known drugstores that do. Why do we not have a procedure in place to recycle all that plastic?
Legally, you can't, because that plastic is considered possibly environmentally contaminated.
So what happens to it?
Most patients just throw them out. They wind up in a landfill where they really shouldn't anyway. Recycled programs, there are some places that actually will recycle hazardous waste, and that's what those bottles are considered. And if they have any medication left in them, it used to be illegal for us to even take them back as a take-back program. It was only law enforcement agencies. But that has since changed in the DEA's auspice. And, we've got to locate take-back boxes, and they'll still have to go back through a reverse distribution vendor who actually does. I guess it's incinerator burning in order to get rid of them.
So there's really nothing to be done about it?
Honestly,
It just bothers me because it's plastic, and plastic is one of the worst ills of our earth.
it is recyclable.
And look how many, I'm one patient and I get like 3 pill bottles every month or so, and sometimes, this is another silly issue, but it bugs me. I have one prescription that's 4 little pills, 5 little pills, and it comes in this giant bottle. Why did they do that?
That comes from the refill center, and it's designed to fill in that 1 bottle size.
Okay.
Yep.
Thank you.
Okay.
Not satisfied, but
From a financial perspective, I know from a plastics perspective, it's wasteful. From a financial perspective, we actually buy those bottles cheaper than we buy the other container size.
It's just sad. It's very sad. Thank you.
Counselor Anglin?
Jeff, you talked about just briefly a while ago about filling prescriptions, a pill or 2 or whatever, and some constituents up in our area, they can't do that because the pharmacy's saying you can't do that without a physician's approval. When the physician's gone, they've left. So they can't get an appointment with the new physician until 2 or 3 or 4 months out. Their scripts are out. So, and you can't give them a 90-day supply or a 30-day supply. What do we do in that situation? We got elders going without meds right now.
Whatever they're out of refills, that's a whole different ballgame. A provider, they do have to have refills in order for us to be able to provide some of the medications.
The medical director can write a continuation
Right.
of orders until they can be seen, so.
Well, that hasn't been passed out to these people because these people had a couple of months left, on their scripts, but the pharmacy wouldn't refill them because their provider was no longer unemployed.
And we can be more proactive on making sure the patients understand that instead of just saying no and turning them away.
Yeah.
So.
Yeah, if a provider's left our system, that's something I'll have to talk with the individual supervisors on, because typically those orders are good until they get a new provider or
1 year later, or their prescription expires.
I know for a fact that did happen.
Okay. That's somebody I'll have to talk individually on that. Okay.
Any other questions? Brian?
Yes, I recently visited Friday, Redbird, and they are really working hard back there. There was actually more people back in the back in the pharmacy working than were out in the waiting room, so that was good. That
is
was really good. And I've tried to have really good close contact with Jerry Kaufman down there, and he's been really, really helpful. I've got filled in all the calls like everybody else. Some of the providers asked, you know, I heard you say that Cerner individuals are coming back. They want to know, are they going to come back to the clinics? Because now that they've worked with it, they've got some questions and they've got some other things.
We've had that discussion about having, you know, letting them kind of get their feet wet, and then that helps generate questions they didn't even know to ask
Right.
or clarify.
Right.
So that is something we plan to do,
Okay.
hopefully within the next 60
Okay, well, good. I'll report back to them. And thank you. Thank you, Madam Chair.
I also failed to introduce another key person, the one you'll probably have the most contact with, believe it or not. So, unless there are other.
You guys have any other questions?
Thank
You
you.
can always feel free to call me. I'll give you my cell phone number too.
I'd mentioned this earlier, like when a patient comes in, say a sore throat, they have to be switched over, right? Their whole chart has to be switched over to the new server. All right, just average, is that taking 30 minutes, hour, 45 minutes?
It absolutely depends on the person doing the job. It just depends. And, you know, your first contact is registration, and they go through and they update all the information.
Right.
And it's slower now because you can't skip vital pieces of information that we need to
Yes,
thoroughly
ma'am.
document the visit and bill if they have a revenue source or a payer source. And so, because those stops are there to make them do their job correctly, it has
Right.
slowed some down.
Right.
It is frustrating, but we need that information because we've purchased this. We need to bill for our visits so we can add more services, buy more equipment, hire more people, do all these things everybody wants. But if we can't bill and collect, and that registration process is something, one of the most important parts of the visit. Because if it's wrong, if the phone number's wrong,
Right.
if something's abnormal, we can't get a hold of the patient. Every little piece of detail is so tremendously important.
I had talked to a lady that worked in the data entry, I can't remember what she said, particular title was, but she was pleased and looking forward to the system, how it kind of makes everybody be accountable for each, each step. But I think I mentioned it to you, probably not real clear, that you know how we set up at the Stillwell cafeteria and get our little photo IDs made. We sit up here, and you see a bunch of computers sitting around, and we're registering folks. Is that something like a prereq before they get that sore throat? Just have them come in and get some of that knocked out of the way to speed the process up. And that was just brought to me from someone who lives in my area. Is that?
I will check and see if we can do something like that. But I don't know how many people we could even reach doing that because it is so cumbersome. If we go to a 3-hour community meeting, I don't know. But it's something we could certainly look at.
Well, like I said, she just brought it up, and at the
Yeah.
time, it seems like a good idea. Cause
You know what? And sometimes we're so focused on just solving the crisis, we forget to think outside the box. So I appreciate any kind of comments that come like that.
Thank you.
Thank you.
Counselor Garvin?
Yes, thank you. I had one person call, I had a bunch of people call, but this one was an elder, and they was needing a refill, and was trying to do it online and all that, but got bogged down, but Cherokee over at Three Rivers, and I told him he'd take care of it, I'd deliver it back, and he said that's not allowed, and I couldn't be the carrier. But I offered to volunteer to do it. But so happened, he worked it out, and they got their meds okay. But my main question is, when will we get this new number? I have one at Hastings, and I have one at Three Rivers. And supposedly I'm gonna get a new number, right?
Whenever you come in for your services,
Yeah.
the first time you'll get assigned a chart number.
I don't get it until I come in.
To clarify,
I do believe.
if you had an existing medical record within the last 3 years in any one of our clinics, you already have a number.
Okay, I have one at Hastings and one at Three Rivers.
Okay, but all that data has been merged into Cerner. And so when you go to your visit, wherever it may be, at Three Rivers or Hastings, you will receive it. But it's gonna work like it would if you went to St. John's or Muskogee. When you go there, they don't ask you for your medical record number. You're Don Garvin, and you give a date of birth and your social security number. And this system will work the very same way.
So if I call in for a refill, what number do I use?
Just prescription numbers.
Like,
Just your prescription numbers on refills now. And if there's duplicate patients or
The number
duplicate
on the
names, the number, right, the prescription number on the bottle, then it will ask for your date of birth for validation.
next visit, I get this number.
You'll get a medical record number. You've already, like she said, you've actually already got one. You just hadn't received it yet. It's when you go in and are seen by a provider or you register through registration, you'll get your number. Now, before, I do want to clarify too that the patient's chart number was on the labels of our prescription bottles. That's no longer your chart number on the bottles. You just go by the prescription numbers itself, just like you would in a retail pharmacy.
Thank you very much. Thank you, Madam Chair.
Any other questions? Comments?
Can I get your cell number, Jeff?
Sure, 918-822-2432.
Thank you.
Thank you, Counselor Vasquez.
Counselor Hack?
Gets a lot off yours, doesn't it?
I just have a comment to make. This system will work because the health care service that I'm under, which is St. Anthony's in Oklahoma City, is phenomenal because you go to your physicians, even the urgent care clinics, and you're connected to the pharmacy and to the hospital. Is that what we're trying to do? Is that correct? And you can use any clinic, so it's great. I'm excited for you because once it is in place, it should be a great thing. Thank you.
And in the very near future, be sure you put your email in the system when you update your record, because we will be going live with the ability for patients to schedule their own appointments, which will be a tremendous thing for people. You won't have this, I think the calls and complaints of, I can't get in. Well, if they can look online and, oh, I could go in at 3:15 today and it looks like Dr. Smith has an opening, I can't wait for that. It'll be a great service to our patients.
That's a scary thought.
Okay,
Okay, any other questions? Thank you.
Okay, thank you.
I didn't introduce
Mr.
Brett
Woodall.
Hayes. I'm sorry.
No, surely not.
The Bible's the first will be or the last will be first.
I'm Brett Hayes. I'm the Director of Contract Health. We oversee the referral systems for all the hospital and all the clinics. We have 3 staff members working at Claremore. It's hard to find back there, but I found it easy last time. If you need to find me, I'm on the other side of that door on the right. I'm probably on the phone, but you'll...
He will be a great source of support and information for you, but he's my best friend, so y'all just don't even think about it.
If you want to spell my name on email, it's 1 T, and you can come back and get a card if you need to.
You know where to find him.
We've grown, and I've been here 11 years, and I started a spreadsheet in 04, and I just update every month, and 500% is what we've grown. I mean, that's tribal funds, that's federal government, IHS, they've realized the value of contract health as far as, economy and healthcare and all that. So it's grown a lot. So we're probably the largest contract health place in the nation.
Any questions for Brett? Sean?
Can I have your number, sir?
Yes. It's 918-453-5290.
Counselor Buzzer?
I just got a comment, Brad. You said there was three people working for us at
Claremore,
Claremore
yes,
Hospital.
yes.
And I can probably tell that Steve never many calls in the last
And it's
3 months
really
than I had.
it's really helped, and we still have the challenge of, Claremore's running their system, and we're running our system, and we've got once everybody's crossed over, it'll be a lot easier, but it's some.
Well, I think the word has kind of got out. When we first started up there, I don't think we were telling people, that, hey, you need to go over here. So hopefully it's getting better all the time. So I haven't got the call. So, but thank you anyway. Thank you.
Any other questions? Thank you.
You? Well, you can see, we've got a lot of great support in our health system, and makes a crazy job a lot easier having the kind of support that we have here.
Thank you, Connie, for bringing all of them together. And like I said, it's a great staff, and they are always very helpful whenever we contact them. Does anyone have any questions for Connie on the report?
I just want to clarify one thing, Connie. Rick said the J and Stillwell Clinic is going to be open the first quarter. Now, he did mean in our fiscal year, correct?
Yes, yes. The quarter begins in October.
I thought he did. I want to make sure I clarify.
Yes, sir.
Thank you.
I do hope to have a date for Stillwell early next week.
Okay.
And then Jay.
Yeah, well, I talked to him the other day.
Okay, good.
Thank you, Connie.
Thank you.
All right, moving to old business, there's none pending. New business, none pending. Announcements, the next meeting is scheduled for Monday, October 12th at 1 o'clock. Any other announcements?
Make a motion, we adjourn.
Second.
All in favor?
10 minutes.
10-minute break.